KAKU 88.5 FM, the voice of Maui. You're listening to Mary Margaret Baker, and I'm the nurse practitioner, and you're listening to The Nurse Practitioner Show. With me today, I have Dr. Thomas Harding, who is a neuropsychologist. And
Aloha.
That's a very interesting profession. There's not too many of you around, are there?
No, there's not many neuropsychologists out there. And a lot of folks go, well, what is a neuropsychologist?
What do you do?
Sure. So briefly, what I do is I assess brain function. So if you've had a head injury and they need to know what parts of your brain have been damaged, I will do quite a few cognitive testing and find out what areas are weak and what areas are still strong. And I also do that for dementia and strokes and Alzheimer's and things like that.
Okay, because what we're going to be talking, you've just recently set up a memory clinic.
Yes.
And as being part of the boomer population, and many people here in Maui and all over the United States, as we get older, we are concerned about our memory, and we have these moments. And so we think, oh, am I losing my marbles? I mean, I've had people say that to me. And, you don't see any marbles coming out, but you have to worry, right?
Yeah, senior moments seem to be finding lots of folks these days, and it can be cause for concern.
Exactly. So you're a neuropsychologist. And so when you work with people, is there a therapeutic element of conversation, and do they need to be in therapy, or what you're doing is doing diagnostic work?
Yeah, I do more diagnostic work. So I will do a thorough assessment. And if it turns out that your dementia is really what we call pseudo-dementia, based on a mood disorder, then yeah, we would refer you to someone that works with us. She's a psychotherapist, and she would help you with counseling and help you with your
meds,
depression, things of that nature. If you want to go the medication route, we could certainly talk. Anything that we do goes to your primary care physician, and if you do need to be referred to a neurologist or a psychiatrist for medication management, we absolutely work with them, and geriatricians as well.
Now, can people self-select and self-refer to you, or do you take all your referrals from primary care or other specialists?
If you have Medicare insurance, and we do take Medicare, by the way, if you're working with seniors, it's
mandatory almost.
Exactly. Yeah. And so with Medicare, you don't need a referral. You can come in. However, I do recommend that you get, and on our website, we have referral forms that they can fill out so that the primary care physician can send us your medical record so I can see, what's been going on. Do you have hypertension or high cholesterol? What's going on with your medications that you're on already, so that we can kind of get an idea what we're looking at before we even start.
Okay, but so I maybe I missed the answer, but can you self-refer, or do you need a clinical referral from someone else?
No, you can self-refer, but we do want you to talk with your PCP so that they'll send us your medical record.
Okay.
Yes.
Now, would you like the medical records ahead of time?
Absolutely.
Okay, so that's critical.
Yes,
yeah.
And that's why we have the form up on the website. And if you don't have access to the internet, you can call us and give us your primary care physician's phone number. We'll call them and fax them at the referral form.
Okay.
And then they'll, with your approval, they'll send us your medical record so we can see.
So you can see what's been happening, what kind of treatments they've been getting. And
yes.
The history, health history.
Well, you need to know that. I mean, if you've had a head injury, if you've been in a car accident, if you've played sports in your life and you've got chronic traumatic encephalopathy, I need to know these things so that before I say you have a certain type of dementia, I need to know your history.
Yeah. So anyways, Alzheimer's. What is Alzheimer's disease? I know there's 22 different forms of dementia?
There's a whole bunch of different ways to become demented. It's almost like the Paul Simon song these days. But so Alzheimer's disease is a progressive type of dementia that involves amyloid beta and neurofibrillary tangles that start to accumulate in your brain. How deep do you want me to go?
Keep it fairly simple. So, because I want them to try to get the behavioral aspects. So if they, they can identify maybe a problem or the beginning of a problem in their family, so they might seek out your help.
So one of the classic characteristic examples of Alzheimer's disease, the first thing they start having problems with is memory. They start having more than just a senior moment. So it may start with senior moments like forgetting why they went into a room or forgetting a phone number or a face, and then those start becoming more frequent. And then, well, that means that they've moved down a line. I've got a graph, if you would like for me. What I'm going to show folks that have a TV in front of them is a graph. And those of you that are on the radio, I want you to just imagine as you go along in life, and it is, it's common, okay, to lose some memory function and some brain function as we age. We call it age-related atrophy. And so it's normal to lose some of your function. When you're in your 70s and 80s and you're having senior moments, if you look at that graph that's on, she's holding up, that's that yellow line. The yellow line is the healthy line, okay? Right here. I'm just trying to find it out. Yeah, there we go. Okay. And then there's another line or path that's on that same graph. And it starts, if you look at it, late 50s, early 60s, you'll see it divert. And it starts going down, 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 and that's the path of dementia. And if you're having senior moments in your, late 50s, early 60s, and even more, then that means you're on the wrong pathway, and you want to catch this as early as you can to correct it. So dementia can be caught early. And it's kind of like if you, when you think of some of the benefits, if you think of cancer, if you can catch cancer early, you can treat it. But if you catch it in stage 4, it's pretty much game over.
It makes it difficult.
It does. So catching any disease, including progressive neurodegenerative disease like Alzheimer's, you catch it early, we can delay the progression.
Well, this is something fairly new, isn't it?
It absolutely is.
Because I remember when people were getting or identified as demented, it was like old age disease. Mm-hmm. And then everybody had dementia. Then it's kind of transitioned to everybody had Alzheimer's. And then they started going through, there were many causes of dementia between Lewy bodies and, whatever.
Frontal temporal.
B12 deficiencies. I mean, very nutrition. Alcoholism. And so then it became a little more diversified. And people felt very hopeless when they got a diagnosis of dementia, Alzheimer's, Lewy bodies. But what you're saying is that there is hope. There is hope for, if you get it, if you start having this, it doesn't mean you're goner. You're a goner and you can't do anything about it.
No, if you're having senior moments, you don't have dementia yet. You're at what we call mild cognitive impairment. See this right here?
Yes.
You want me to...
Yeah.
Can I do this?
No, yours right here.
Okay. So for those of you listening, if you were to hold your hands out in front of you about shoulder width apart, on the left side of on my right that I'm holding is normal brain function. Then over here on the other side is end stages of dementia. And somewhere in the middle there's something called, you see the words SCI, subjective cognitive impairment. And that's someone that's having senior moments. You know that you've had some changes. You know you're not as sharp as you used to be. But you're not demented yet, but you have slid on down the line. And then you see the next spot is called mild cognitive impairment, or MCI. Now, mild cognitive impairment is a diagnosable condition. If you read some of the articles, it says prodromal dementia, pre-dementia. We call it mild cognitive impairment because you come in and we do your testing and you score in a range that tells me, okay, we've got something that needs help and it needs it now. If we can catch it at that stage, we can get aggressive with treatment. We can work on your diet. We can start stimulating your brain. We can get you walking a bit more and get your blood flow back up to your brain, because your brain has to have that blood. So that's the mild cognitive impairment. And then once you leave mild cognitive impairment and you get to the early stage of dementia, okay, that's kind of like You've lost about 30% of your hippocampus in your temporal lobe, and when
Which
a brain
is part of your brain
is a part, it's part of your brain, and if once you lose about 30% of it, it's hard to get it back. So what we would try to do at the early stage of dementia is work with some psychopharmacotherapy, medication, things of that nature. So ideally, we catch it before you get there.
Now, what about? I know that we've had Dr. Steve Blake on the show,
Yes.
and his wife.
Yes, great people.
Different topics. I had them on separately.
Yes.
And but Steve went over and was talking about the research, and you were involved with the same research, apparently. Yeah.
Yes, Dr. Blake and I, he would come over to Oahu, and I was working over there for a number of years, creating a neuropsych department with a group of neurologists, and we were doing research, and one of the research projects we did with Dr. Blake was the nutritional aspects of preventing dementia, and it was excellent outcome on that. And so now that I'm over here in Maui, Dr. Blake and I are working together, and so he is the nutritional neuroscientist
component at the memory clinic.
At the memory clinic.
Okay,
so
very good.
If you come in early, we can help you with the nutritional piece as well.
Because I know he's had these supplements.
Yes, the brain and body food. I take his supplement. I have been taking vitamins, oh my gosh, for most of my life. And, these companies change the formularies on them. Starts off good, and then they start cheapening on you. And next thing you know, you're not even sure you're getting anything. Dr. Blake's supplements, I took them for 2 weeks, and I had more energy than I've had in a long time. So now it's all I take. I don't even bother with the other stuff. I take his brain and body food. I absolutely love that stuff.
Yeah, he's pretty amazing, and he's done a lot of research. He's done a lot of writing and publishing.
Yes, he has. Prolific author.
Prolific.
Yeah, I have just the one, but he's done lots of.
Because this is You Can Prevent Alzheimer's. I think this is a critical book. Now, where can people get it?
Okay, so it's on Amazon. You can go up to Amazon and find it. It's on our website, www.bedementiafree.com.
Then dementia, DEMENTIA, free, FREE. .com. Okay, but this book, I think I've read. I haven't read the book, but I've read about the book. And you did win an award with it, right?
Yes, it got the ebook award. And this book, I completed this book in 2010. So this information has been out for some time. And we've been preaching dementia prevention for quite some time. And Dr. Blake's of the same mindset. So we get along well in that regard. And the research that's coming out every day is starting to show that yes, you can, if you eat healthy, live healthy, stimulate your brain, you can really ward off the signs of dementia. And
are you a vegetarian?
Not quite. I eat a lot more vegetables than I do meat. I've pretty much removed most of the meat in my life, but I still succumb every now and then. But mostly veggies.
As we age, I would say it's normal to have some deficit in memory. Is that what you would say?
It is normal to have a little bit that age-related, but if you're starting to have senior moments that are starting to become more frequent, that's not normal, okay? Especially if you're a baby boomer and you just turned in your 60s, or maybe your late 60s, and you're having more senior moments more frequently, I would say you need to come in and see where you're at. And the reason I say that is
baseline.
Yeah, because the baseline might be mood, because you can have something called pseudo-dementia, which is basically a mood disorder that masks itself as a dementing process, because a depressed brain is a slow brain and it's a forgetful brain. And so if it turns out that we do the test and your test is looking good, but we see that it's mood, well, counseling. This is a reversible type of dementia. Vascular disease, cerebral vascular disease, is a reversible type of dementia. You can stop it in its tracks, but you got to know what type you have, and that's what we do with the testing. So with cerebral vascular disease, I'll use that as an example. One of the telltale signs of that disease is attention, and because the frontal lobes, where you think and do all your planning, it's fed with some really small blood vessels, capillaries, and they're the first to get plugged up. So with vascular dementia or disease, one of the things that people have trouble with is attention, and consequently, if you're having trouble with attention, you're going to have a memory problem, because if you can't stay focused to attend, you're not going to remember later.
So you were talking earlier a little bit about mild cognitive impairment.
Mild cognitive impairment, or MCI for short. And so that's a stage that comes just before early stage dementia.
Now, is it treatable at that point?
Absolutely. If you come in and that's where you're at, we have to get aggressive. Like, you don't have time to waste. You've got to get busy and change. And they've discovered that most cases of dementia are environmental. It is not genetic. Only about 10% of the cases are genetic. The rest of it's environmental. The things you eat, the things you don't do, like walk and keep your heart rate up, or the things that you don't eat, like you're not eating your vegetables, you're eating pizza and burgers and fish and chips and stuff like that. That is going to clog up your arteries, and not just your heart, but in your brain as well. So these are things under our control.